Some people have an overly sensitive gag reflex, and this can make your visit to your dentist quite challenging. So here are a few tips and strategies to prevent gag reflex. Our gag reflex is a natural mechanism to prevent foreign objects from going down our throats. Now, some patients suffer from hypersensitive gag reflex. This occurs when a normal reflex becomes heightened for some reason. Usually, this is a learned or a conditioned response. Now, many people gag at the dental office, especially when they're having an X-ray taken or if they're having a dental impression done. Now, this can be quite embarrassing for patients and it can lead to anxiety. And because of this, they dread further dental appointments. Everyone is different, and what might trigger a gag reflex in one person may not be the same trigger for another. So let's look at some of the common triggers that would elicit a gag reflex. Number 1 is cotton rolls. Number 2, dental x-rays. Number 3 is dental materials, especially if they're bitter to taste, like certain gels that are used. Number 4 is dental impressions. Number 5, mouth props. Number 6, fear or anxiety of coming to the dentist or the fear of the procedure. Number 7, a small mouth. Number 8, a narrow palate. So let's look at a few tips to prevent gag reflex. Now, you'll have to try and experiment with different strategies to see what works for you, as everyone is different. Number 1 is communicate with your dentist. Let your dentist and the dental team know about your sensitive gag reflex. It's only when you tell them that they can work with you and find out the root cause of the problem. Number 2 is try and breathe through your nose. Avoid breathing from your mouth. And if you have a cold or you're unable to breathe through your nose, try and use a nasal decongestant just before your appointment. Number 3 is try and stay calm. Sit upright with your chin pointing downward. Try and avoid lying flat or tilting your head backward. Number 4 is to swallow just before the dental professional places something in your mouth. Now let's say, for example, you're having an X-ray done. So before your dental professional places the X-ray holder in the mouth, swallow. Avoid swallowing when you have the dental X-ray in the mouth. Number 5 is use a mouthwash. So just before the dental procedure, make sure that you rinse your mouth with mouthwash. You can carry your own mouthwash from home, or your dental professional might be able to provide some. Number 6 is try and wiggle your toes. So do this when you have something in the mouth. Say if you have an X-ray holder or if you have an impression tray, try and wiggle your toes and focus on that till the procedure is done. Number 7 is to talk to yourself or hum a tune. Tell yourself that this procedure is going to be really short and it will get over soon. And you can also try and hum a tune, or you can even try and remember the lyrics of a song. Basically, try and distract yourself from what is happening. Number 8, which seems to be quite effective for a lot of patients, is using salt. So just before the procedure, you can take a bit of salt and place it on the tip of your tongue and a little bit on the sides of your tongue. And then your dental professional can carry on with the procedure. This, again, is quite effective. A lot of patients have found this really useful. Number 9 is getting involved in the procedure. Talk to your dental professional and see if you can get involved in the procedure. So let's say, for example, that you're having an X-ray taken. So see if you can hold the X-ray handle, or if you're able to place it yourself. So your dental professional can show you or guide you where to keep it, and then you can place the X-ray film yourself. So that will also help in preventing gag reflex. Number 10 is another distraction technique which can be done when you have something in the mouth. So if you've got an impression tray in the mouth, try and lift your leg 6 to 8 inches off the chair and point your leg forward. So try doing one leg at a time. So lift your right leg up, point it forward, hold it there for a few seconds, bring it back down, and then do the same with your left leg. Number 11 is anesthesia. Now, if all these strategies don't work, your dentist might choose to numb you up. Now, the length or the duration of anesthesia depends on the type of anesthesia used, but usually the effect will wear out in about 2 to 3 hours' time. Now, the other option that you could opt for is having these procedures done under sedation, but all practices do not offer this option, but it's worthwhile talking to your dentist about it. The main thing to remember is do not worry if you gag at the dental office. We see this on a daily basis and you're not the only one. If you have an issue, make sure you talk to your dental team. They may even suggest certain desensitizing exercises that will help treat this issue. Hope you found this video useful. Do share it with your friend and family and make sure to subscribe for more such videos.